Hello, my name is Akila Jackson, and I'm going to be performing an ostomy application, and I will talk through a removal as well. So the first thing I will do is check the patient's chart, look for the order. I will perform hand hygiene, enter the room, close the door, pull the curtain, and make sure there's adequate lighting. Hi, my name is Akila. I am your student nurse today. Can you please state your first and last name as we check your ID band? Okay, great. Thank you, Mr. Brown. So the first thing I need to do today is remove your ostomy and apply a new one. I know it's been about 5 days since you had it replaced, correct? Yes? Okay, so I know you know that we do need to change this every 3 to 7 days. All right, okay, great. So let's go ahead and get started. So the first thing I would like to do is apply some gloves. This is a non-sterile procedure, so regular gloves are okay. I will have my supplies at the bedside, so I have my barrier attachment for my ostomy. I have my ostomy bag. I have chucks. I have wipes. I have gauze, and I have scissors and a trash bag as well. So I'm going to apply the chucks to the patient, so that way to prevent the patient from getting any stool on their gown or anything. So put the chucks on. I have some adhesive remover, so I'm going to pretend like we have already have an ostomy on here, so I'll apply some adhesive remover to make it easier to remove from the patient's skin. So now I'll hold the patient's skin taut, and I'm going to pull the skin away from the appliance, not the appliance away from the skin, to help avoid adding to any irritation in that area. All right, once the ostomy is removed, I'm going to wipe the stoma, clean of any stool. You can use regular toilet paper or a towel or wipe. I'm going to cover the stoma with gauze as I clean the skin around the stoma. A little irritation around the stoma is normal, about a ½ inch around the border of redness is normal, completely normal. I'll note the color of the stoma. It's red. It has a little bit of bleeding, but that's normal. So I'll just clean that blood off as well. I'll make sure to let the patient know if they have any continuous bleeding, any bleeding greater than 4 tablespoons, that they need to notify the doctor right away. If the stoma is purple in color, or if it has any cuts, I'll tell the patient to inform the surgeon, or if I note it, I will also inform the surgeon of those abnormalities. If I notice the skin is red and it's weeping and it's painful and it's itching, then I know that is a sign of infection. So I'll also notify the physician or the surgeon about those findings. If there's any pus as well, any drainage, any abnormal drainage around the skin, then I'll also do that. I'll notify the physician. If the patient has diarrhea, I'll let the patient know that they need to continue drinking about 8 cups of water a day, plus they can have broth and any electrolyte fluids like Gatorade, broth, Gatorade or Pedialyte, and so they can stay well hydrated. But if they have it for more than 2 days, 2 or 3 days, the diarrhea, then they need to notify their surgeon immediately. If the patient does not have a bowel movement for 4 to 6 hours, that is not normal, and I would let them know that they can apply some pressure around the area, because they may have an obstruction or a blockage due to their food. So if they apply some pressure, the stool might come out, but if not, they need to notify the surgeon immediately if that is an issue. Also, if upon removal, if I notice or the patient notice protrusion, then but the stoma is still moist and red, it looks normal, then that is okay. They can continue to use, to apply their stoma or their ostomy. But it is important to notify the doctor. And also, if the stoma becomes inverted, they can still use that stoma site. They would notify the surgeon, but they may have issues with applying the ostomy bag because of the inversion. So anything abnormal, always notify the surgeon. Okay, so now I'm going to apply my ostomy bag, but first I need to measure the stoma. So I'll remove the gauze, wipe if I need to. I'll use a little measuring device to measure my stoma. Okay, so I got my size that I want, and I will make sure that I will cut out the circle from the application about an 1/8 bigger than what I measured. So I'll use some scissors, cut that out based on my measurement. All right, so now I will attach, I still have the gauze on, of course, and the chucks. So now I will go ahead and attach the bag to the application, because you don't want to attach, I do not want to attach the bag after I apply the barrier, because then I will have to press down on the patient's stomach or the area where their stoma is located. I have to press down to get the bag on to snap it in place, and that will not be good. So you'll always apply the bag first, snap the bag in place first, and then you apply. Remove the gauze, make sure there's no, or actually before I apply that to over the stoma site, I'm going to, if the patient's skin is red, I'll apply some barrier powder, and then I can apply some barrier paste if needed to fill in any empty spaces and to hold the barrier, the application in place. So I'll let that sit for about 30 seconds or until it's completely dry. I'm not going to apply that ostomy bag until it's completely dry. Once it's completely dry, then I can go ahead and apply the ostomy pad to the skin. Of course, I would remove the adhesive, the backing first. Apply it on there. Open up the bag. Let any air out of the bag, all the air out. Then I will close up the bag again and Velcro it together, or close it up, however it is. But usually I've only seen Velcro closures. So, all right, and that is it. Of course, the patient will be in a comfortable position, most likely semi-Fowler's. And once the ostomy is in place, then I can get the patient in a comfortable position, ask them if they're having any pain, make sure to give them their personal belongings, and see if they need to use the urinal or a commode or a bathroom to urinate. And that is it. Oh, and also, if I am removing a previous ostomy, of course, I will empty that bag first. I will empty the bag first before I remove the ostomy appliance. And I will measure that and document the amount and the color. All right, and that is it. Thank you.